common nursing interview questions. Tell me about yourself. Tell me, what do you know about the role of a nurse? Why should I hire you? What are your weaknesses? What is your greatest strength? Are you a team player? Tell us about a time that you worked well with the team. Why are you leaving your current job? What are you passionate about? What really motivates you? Are you a self-motivator? Where do you see yourself in the next 5 years? Why are you the best person for this nursing job? Why do you want to work for this hospital, organization? How would you contribute to the improvement of our organization as a nurse? Do you have any questions for us? Tell me, why did you decide to become a nurse? I was inspired to build my career in nursing because I come from a long line of nurses. Growing up in my family and seeing how much my parents loved what they did every day was both inspiring and motivating to me. I am interested in this job because I feel that I have learned a lot from them about what it means to solve problems, care for patients and make a difference in people's lives. Explain, when were you the happiest in your job? When I'm interacting with patients. I'm the happiest when I know I'm doing a good job for them and providing the best possible care. When a patient thanks or smiles, it really makes my day. Explain, how do you handle the stress of this job? I know how stressful this job can be, so I take self-care very seriously. In previous job I felt like I had to bottle up my emotions and I felt like I didn't have enough emotional support, so I reached out to other team members and told them that I was available whenever they needed to talk. This small thing changed my team's dynamic and it meant that we grew closer and felt more able to share our emotions when we felt stressed or upset. I have a great support network and my partner is also working in healthcare, so they really get it when I explain why I feel stressed out. I also make time during the week to go to the gym and I try to respect my free time by not taking my work home with me. Explain, how would you handle a patient who complains? Some patients like to complain about everything. It's just their nature, and also, I understand that they can be worried about being in a hospital. So, I always try to be very patient and reassure them that we were doing our very best for them. Would you become a doctor? And explain. No, I enjoy the personal contact with my patients and the comradeship with my colleagues unique to nursing. I plan on advancing my career as a nurse, not a doctor. I enjoy the medical field tremendously and plan to continue my nursing education throughout my career. I have no ambition to be a doctor, just the best nurse that I can be. Other important nurse interview questions. What's the hardest thing about being a nurse? Explain, out of the 6 C's for nursing, which do you feel is the most important and why? What do you do if your replacement does not arrive? In your opinion, what are the best and worst aspects of nursing? How would you handle a disagreement with a doctor? What is professional duty of candor? Tell me what you understand about safeguarding. How would you deal with a rude patient? Which system do you use for EMR? How do you respond when people ask for your personal diagnosis outside of the clinical setting? Have you ever accidentally caused a conflict? Are you comfortable working with other doctors and nurses? What's your policy on overtime? How long are the shifts? What do you find most rewarding about being a nurse? How would you handle a patient who struggles with pain management? How did you handle a situation where you disagreed with a physician over a diagnosis or a course of treatment? How do you respond when family members ask for your personal diagnosis? Describe how clinical rotation prepared you for a career in nursing. Do you keep up to date with developments in the healthcare industry?
Like, share and comment. Don't forget to click the subscribe button. Click the bell button for latest updates.